Welcome to the Modern AT. In this video, we will clarify the role of athletic trainers in modern sports medicine, which goes beyond the visible parts like tape and ice bags. We will place the athletic trainer in the full healthcare picture: prevention, evaluation, emergency response, rehabilitation, and collaboration. Our objectives are to define the athletic trainer as a healthcare professional and describe their major practice domains across the continuum of care. We will then apply this role to a clinical scenario. The core idea is that athletic trainers connect sport demands with vital healthcare decisions. Athletic trainers are not personal trainers or coaches. They are healthcare professionals. Their responsibilities include injury prevention, emergency care, diagnosis, and rehabilitation. They practice in collaboration with physicians. Athletic trainers bring healthcare directly into sport and physically active environments, making healthcare decisions in these contexts. The athletic trainer's role spans a full care continuum, including risk reduction, evaluation, emergency care, rehabilitation, return to sport, and administrative outcomes. This process is proactive, acute, rehabilitative, and administrative. The patient may move forward, backward, or sideways through this system, managed by the athletic trainer. The Board of Certification organizes athletic training practice into 5 major domains: risk reduction, assessment and diagnosis, critical incident management, therapeutic intervention, and healthcare administration. These domains show the breadth of the profession. In practice, they blend together in almost every patient interaction. Risk reduction is a critical, often invisible part of the AT role. Athletic trainers identify intrinsic factors like prior injury and sleep, and extrinsic factors like heat and equipment. The goal is to identify and modify risks to reduce the chance or severity of injury and illness. In critical incidents, the AT's value is operating within a prepared system. Emergency action plans, or EAPs, are essential. They must cover assigned roles, venue access routes, emergency equipment location, and communication with EMS. The best EAPs are practiced and rehearsed. When an athlete is injured, the athletic trainer begins clinical reasoning, not just looking at the injury. The process includes a thorough history, observation, and examination. The AT then makes a decision on the appropriate next steps, guided by evidence, context, and patient safety. Therapeutic intervention is more than doing exercises. It involves protecting healing tissue, managing pain, and progressively restoring function, power, balance, and sport skill. Modern rehab is criteria-based, meaning progression is based on demonstrated readiness, not just a set calendar period. Return to sport clearance is a complex risk management decision, extending beyond the patient being pain-free. The AT considers tissue status, objective function, sport-specific demands, psychological readiness, and physician input. The AT balances performance goals with paramount patient safety. The athletic trainer acts as a communication hub, coordinating care between the patient, physician, coach, and other staff. This communication must be ethical, protecting patient privacy while sharing what is needed with the right people at the right time to ensure safe decisions. Modern ATs use data for documentation and tracking outcomes. Documentation supports continuity of care, serves as a legal record, and allows for quality improvement. Outcomes tracking moves beyond vague sentiments to measurable patient progress and service effectiveness. The athletic training profession extends far beyond the traditional sideline. ATs work in secondary schools, colleges, professional sports, clinics, military, industrial settings, and more. The transferable skill is clinical decision-making in physically demanding environments. Applying this to an ankle sprain, the AT immediately screens for urgent concerns. Next, they evaluate and manage acute symptoms, deciding on referral or restriction. Rehabilitation progresses mobility and strength. Finally, return to sport requires objective criteria. The AT translates the injury event into safe next steps. Key takeaways are that athletic trainers are healthcare professionals with roles spanning prevention to return to sport and administration. The AT acts as the bridge for the medical team. Modern practice is evidence-informed, patient-centered, and systems-based. The modern AT is a clinical brain and systems thinker.